Welcome and very good morning, dear doctors. Today we are going to discuss the previous year multiple choice question from NEET PG entrance examination, and today we are talking about the clinical anatomy. And let's start our discussion. So our question is here. A patient present with the history of vision loss. On investigation, an aneurysm was identified causing the compression on the optic chiasm. Which of the following artery is most commonly involved? So here are the options. Option A, anterior choroidal artery. Option B, anterior communicating artery. Option C, middle cerebral artery. And option D, anterior cerebral artery. So go through the option and answer the question carefully. So here the right option is option B, anterior communicating artery. So yes, relationship matters. So let's dive into the typical relationship at the base of the brain in between circulus arteriosus and the visual pathway. So in that particular question you can see the typical symptom is vision loss and the clinical diagnosis is cerebral aneurysm. So there must be a relationship between the two. So see the circulus arteriosus at the base of the brain. As you all know, Circle of Willis or circulus arteriosus is formed. It's a polygonal or hexagonal structure actually. Having you can make the three components. The anterior circulation, it is formed by the two anterior cerebral artery, right and left, and adjoining anterior communicating artery. The lateral component formed by the right and left internal carotid artery, and the posterior component formed by the two posterior cerebral artery, this one and that one, and the posterior communicating artery. And as you all know that posterior cerebral artery is the end part of the basilar artery. So circulus arteriosus actually is a system, is a arterial circulation system formed by the internal carotid artery and the vertebro-basilar artery system. So now let's see the relationship between this arterial system, this polygonal system with the visual pathway. See this one, this is the optic nerve, this is the optic nerve, this is the right optic nerve, this is left optic nerve, and this forms the optic chiasm, and from there optic tract is formed. So you can see that Circle of Willis surrounds optic chiasm in infundibulum and the mammillary body. This is the infundibulum and the mammillary. Those are the vital structure, and they are within the subarachnoid space. They are within the subarachnoid space. So you can easily see that the anterior communicating artery is in close relationship with the optic chiasm, whereas the internal carotid artery, bifurcation of the internal carotid artery related with the optic tract and the optic nerve and the optic chiasm. So let's see that why the aneurysm causes the visual loss. So from the particular diagram you can easily identify that the close proximity of the visual pathway, anterior visual pathway, lie with the arteries of the Circle of Willis. As I have already discussed, that optic nerve near the internal cardiac artery, optic chiasm above the anterior communicating artery. So in the said question, the structure involved is the optic chiasm with the said aneurysm, and with enlargement of the aneurysm it actually compresses the visual structure. And the typical visual symptoms may precede the aneurysmal rupture, causing the subarachnoid hemorrhage. As you all know that there are the formation, the etiology of the cerebral aneurysm is still debatable. Initially it was thought that the aneurysm was congenital origin, but infrequent occurrence in the children is against the possibility, and recent evidence suggests that the aneurysmal vascular lesion is due to the degenerative changes in the muscular and elastic component of the vessels, and those are associated with the hypertension. And typical aneurysm forms at the branch point of the major cerebral vessels. So mostly aneurysms are related to the acquired situation as the evidence says. Genetic predisposition are there related to the etiology of the aneurysm, but still not known properly. Several families have the increased tendency to have aneurysms, and it has been seen. Still, the typical biochemical abnormality related to that particular thing is debatable. And related to the congenital origin of the aneurysm, some studies showed that the deficiency of the type 3 collagen had been seen in patient with aneurysmal subarachnoid hemorrhage. So from this particular point we have seen that aneurysms are mostly acquired, and the associated conditions, there is significant association with the fluctuation of aorta, fibromuscular dysplasia, polycystic kidney disease, head and neck disorder, and smoking. Yes, smoking increases the multifold chances of SH in a patient with aneurysms. So let's see the common aneurysms causing the visual disturbances. Before that, you should know the typical layers of the arterial wall. We know that the arterial wall consists of tunica intima, tunica media, and tunica adventitia. And tunica intima formed by the endothelium and subendothelial connective tissue and the internal elastic lamina, whereas the tunica media is formed by the extracellular matrix and the connective tissue, and the tunica adventitia, the outermost layer, is formed by the connective tissue surrounding the nervi vascularis and the vasa vasorum. Why you should know the typical structural basis of the arterial wall? Because aneurysms are formed, are classified on the basis of the layer involved. The true aneurysm involves the all layers, tunica intima, tunica media and tunica adventitia, whereas the pseudo aneurysm involves the tunica intima and the tunica media. And disruption of the tunica intima and tunica media usually occur in the pseudo aneurysm, and the typical aneurysmal dilatation is surrounded by the tunica adventitia and the perivascular clot. Another part of classification based on the circumference of the arterial wall. If the whole circumference are involved, it's called the saccular aneurysm. And if the part of the arterial wall circumference involved, it's called the fusiform aneurysm. So, as you all know that cerebral aneurysm are mostly 90% of cerebral are the Brady's aneurysm. And the common aneurysms causing the visual disturbances are in the internal carotid artery and the ophthalmic artery aneurysm at the junction actually, and it can cause the optic nerve compression. An aneurysm causing the optic chiasm compression is the region of the anterior communicating artery region. And supraglenoid IC aneurysm causing the compression of the optic nerve and optic chiasm, both structure. So let's go through the mechanism of the visual loss. What are the causes? Direct compression of the optic nerve, chiasm and of the tract. Subarachnoid hemorrhage causing the hematoma after rupture of the aneurysm and compression of the surrounding structure. And another thing is one of the most important is the vasospasm leading to the ischemia of the visual pathway. Vasospasm actually you can detect it clinically as well as through the angiographic finding. And in case of vasospasm, the symptoms will occur in the absence of the aneurysmal rebleeding. Clinically, you can catch the events of vasospasm by increased deterioration of the consciousness or formation of the new focal neurological deficit, like that. Another thing that can cause the visual loss is the raised intracranial pressure. This is due to the affecting the optic nerve function. Now let's have a quick clinical takeaways. So optic nerve compression can cause the monocular visual loss. Optic chiasm compression, it can cause the bitemporal hemianopia, and optic tract compression, and it can cause the contralateral homonymous hemianopia. So in our coming videos we'll we will have more basic uh, things related to the visual pathway and their clinical significance, and these are very important topics for your upcoming examination. So in short, unexplained visual loss or visual field defect with headache, you must evaluate for aneurysm, and you have to go for the early imaging as well as the neurosurgical consultation. This is all about our today's session. Welcome to AiMedTech. This is Dr. Ratul Basu. Stay strategic, stay tuned. See you soon.